Now, another important question which has been asked so many times, and every person or a student feels some problem in solving such kind of a question, a twisted kind of a Park 3 step test. So, let's see this question. We have got a 55-year-old man who was in a car accident several days ago. Now, he is having intermittent vertical diplopia. So, here what you have to see that the person is having vertical diplopia. So, that means the muscle that is involved is the elevator or a depressor. Since his visual acuity is 20 by 20 in each eye, so visual acuity is not affected. Motility is diagrammed below. If only a single muscle is involved, which muscle is paralyzed? So let us try to see what is happening actually. If you look in the primary gaze, what is the problem? If you look in the primary gaze, so in the primary gaze, the person is actually having what? This person is having the hypertropia. So this person is having the hypertropia. If you look here, there is a right eye hypertropia, or you can see here that there is a left eye hypotropia. So because we do not clinically analyze and evaluate the patients in terms of the hypotropia, we are saying that it's a right eye hypertropia. But either way, if you see, either it's a right eye hypertropia or it's a left eye hypotropia, and this is increasing in which gaze and which tilt. Okay, now if you look the person in the right gaze, it is normal. You cannot see any increase in the hypertropia or the hypotropia when the person is seeing in the right gaze. But if you look in the left gaze, can you see in the left gaze? So it is increasing in the left gaze. This is increasing in the left gaze. So we have got the right eye hypertropia, oblique left eye hypotropia, which is increasing in the left gaze. Now you have to see the head tilt also. So instead of telling them in the theory, they have given you the image and you can easily see this. So tilting towards the right. Now if you see the tilting towards the right, you can see this hypertropia. But if you see the tilting towards the left, it is normal. So it is increasing in the right tilt. It is increasing in the right tilt. Now this becomes a simple question. You can easily solve this question that there is a right eye hypertropia which is increasing in the, which gaze it was? In the left gaze. It is increasing in the left gaze and the right head tilt. Now try to solve this question and give me the answer in the comment section. By the time I will also tell you. Okay, so try to solve this question if you already know this. So either we have got the right eye hypertropia or we have got the left eye hypotropia. How to solve such question? Right eye hypertropia means the right eye depressor palsy we could have, or we could have left eye elevator palsy. Okay, we can have right eye depressor palsy or we can have left eye elevator palsy. Now what are the depressors of the right eye? So we have got the right eye here, we have got the left eye here. This is your right eye, this is your left eye, and depressors are right superior oblique or the right inferior rectus. We have got left eye elevator, so left superior rectus or the left inferior oblique. So this is your step 1. This is your step 1. You have find out the 4 muscles which could be involved. Now coming to the step 2. Step 2 increases in the left gaze. Step 2 says that it is increases in the left gaze. You have to see in which gaze it is increasing. It is increasing in the left gaze. Now try to make left gaze here. Left gaze is this. So when the person is seeing in the left gaze, left eye abduct and the right eye adduct. Okay, so adduction. Now many people get confused that recti are adductors and the obliques are abductors. No child, we don't have to see this here guys. We have to see that the maximum elevation and depression in the eye takes place by which muscles. So maximum elevation and depression in the adducted eye takes place by the obliques, and the maximum elevation and depression in the abducted eye takes place by the rectus muscle. So I hope you are able to correlate this, because rectus muscles are working maximum in the abducted eye and the oblique muscles are working maximum in the adducted eye. So you have to take the oblique in the adducted eye or you have to take the rectus in the abducted eye. So out of the 4 you are left with the 2. Now you go with the step number 3. When you go to the step number 3, you will see that it is increasing in the right head tilt. it is increasing in the right head tilt. So look at the head tilt. Now it is increasing in the right head tilt. So if you look here, this person has tilted the head like this. So it is something like this. When I'm tilting my hand, eyes will roll to the opposite direction to counter balance. This is your counter rolling mechanism. So right eye will intort, right, and the left eye will go like this. So this will extort, right. Now you already know that superiors are intorters. So here I should have a superior muscle, while extort means I should have some inferior muscle. But left side pe we had selected the superior rectus. So this is wrong. So your answer is right superior oblique. You just go by these 3 steps and answer is yours. So look at the options now and just see where there is right superior oblique and just click it. Okay, you don't have to read all the options here, because reading the options will not make you know anything here. Just go by 3 steps, okay, and you have got the answer. If you have given the this language directly, then it becomes easier for you. If you have the pick also, then also not a problem. First look in the primary gaze, look at the right gaze, look at the left gaze, and look at the head tilt. Okay, now sometimes they say that it is increasing in this particular head tilt, then you have to go with that head tilt. But sometimes they say the person comes with the left head tilt. Now if you look here, the person has a right head tilt increase hypertropia, but the left head tilt no increase. So this person will have left, okay, obviously, because if you go by the muscle also, the superior oblique people will show you opposite head tilt. So right superior oblique palsy will show me the left head tilt. So it is not increasing in this, it is showing, it is compensating. That means it will increase in the right head tilt. So don't take the left head tilt, you have to take that tilt in which it is increasing. So that is a major point. I suppose you have understood it. All right.